Pediatric dental emergencies, first aid and preventions.
In my practice, I always prioritize emergency that are connected with kids. I always open slots for this type of sessions and for the kid emergency. I always prioritize kids before grown patients with their emergency needs. So in this situation, it's very important to speak about three major situation that can happen. Mostly the emergency related with kids are with a few varieties, mostly are connected with trauma or from some hit from something like a pendulum. So what is important here, after this type of trauma, it can happen partially or complete fracture of some of the teeth of the kid. And in this situation, if it's a complete fracture, it's very important parents to find the piece, get saline solution and put the piece inside until they get to the dental office. It's very important that the patient arrived in the dental office very quick, not more than 2 to 3 hours. And you need to know that as much as you prolongate this visit, as less are the chance for successful treatment. It's very important to mention here that another possibilities after trauma is that the kid can have fully exposed teeth outside of the mouth. What is this? What's that mean? That the kid actually after the trauma the teeth with the root together, and most of the time the teeth with the root is somewhere near around the place where the trauma was. So it's very important, again, you as a parent, to find the tooth and put it again in a saline solution. And it's very important that you are really fast with visiting to the dental office. As I said, in my practice, we always prioritize our kids before other patients, and in this situation we will take the kid right away. So here, after we receive the kit, it's very important to check the place of the trauma, to see for and ask the parents for some consciousness lost or some kind of dizziness, which are very important for the parents to make another visit with their neurologist or their personal doctor. So if we have a fractured tooth, we have many possibilities, but the best one that I think is to stick back the piece to the tooth which is remaining in the mouth. And most of the time, in a long term, this is a very successful treatment. In a situation where the kid actually exposed the tooth out of the mouth, we do the so-called reimplantation, which is procedure very precise and very technique sensitive to bring back the tooth with the root on the place where it was. And here, as I said, is very important the timing. Also, there are other possibilities of traumas which are connected mostly with fall or hit of the chin, so-called broken or fractured condyles. In this situation, we have very successful protocol in our practice for treating that, but again, the timing is very important. So if you have this situation with your kid, it's very important that you act immediately.